Hi everybody, it's Helen Birch here. So today's video, I'm just going to be talking about IBS. So I'm going to be talking about irritable bowel syndrome, the symptoms and causes, and how hypnotherapy can treat it. So have you ever been diagnosed with IBS but medication has been unable to reduce your symptoms? Are you fed up of worrying about what you eat and are fed up with constantly having to change your diet? Have you had enough of supplements that simply don't relieve your symptoms? Instead, could you imagine being able to leave the house without worrying where the nearest toilet was, feeling in control of your body at last, enjoying a meal or new food, having a body that doesn't have constant bloating, constipation, diarrhoea, or painful cramps? Then hypnotherapy can help you to understand the link between your mind and gut and ease the stress and anxiety caused by IBS to provide relief from your symptoms of IBS. So IBS is a common disorder of the digestive system and guts that causes the bowel to be very sensitive. The condition causes recurring pain and discomfort in the abdomen, and often the nerves and muscles don't work as they should. IBS is one of the most common disorders of the digestive system, affecting 1 in 5 people during their lifetime. Studies have found that women are more likely than men to suffer from IBS, and also their symptoms tend to be more severe. For many people living with irritable bowel syndrome, they can find it just a minor inconvenience, but for others, it can seriously affect their quality of life. While IBS can develop at any time, it often begins when you are in your 20s. Some people with IBS experience constipation, while others have diarrhoea, and some may suffer both. The pain can range from mild to severe and may happen at certain times of the day. So what are some symptoms of IBS? Symptoms can vary and can be experienced at different severities. The symptoms can be triggered by food or drink, stress, or food poisoning. Some of the most common symptoms include having stomach pain or cramps, which are usually worse after eating and better after going to the toilet. Bloating, so your tummy may feel uncomfortably full and swollen. Diarrhoea, you may have some watery poo and sometimes you may have a sudden urge to go to the toilet. On the other side, constipation, where you may have to strain when going to the toilet and it feels that you cannot fully empty your bowels. It can also cause flatulence, passing mucus from your bottom. It can also create tiredness and a lack of energy, feeling sick, backache, problems having a wee, like needing to go often or having a sudden urge to go to the toilet, or feeling like you cannot fully empty your bladder, and not always being able to control your bowel movements. So what are some of the causes of IBS? While the exact cause of IBS is unclear, some research suggests that it may be due to overactivity of the gut. For example, if the contraction of the muscles in the gut wall become abnormal or overactive, problems such as increased sensitivity to the amount of gas in the bowel and increased serotonin levels, which occur after eating at certain times of the day or certain times of food, are also thought to play a role in the development of IBS. Additionally, your emotional and mental state can trigger problems in the gut. Strong feelings of anxiety and stress may cause the person to suffer irregular bowel habits, and then symptoms can get worse. These emotional feelings interfere with the regularity of the digestive system, even in those who have not previously experienced IBS. So what are some treatments of IBS? So IBS is a medical condition, and it is important that you consult your doctor first for advice and diagnosis. The most important thing you can do is to share with your doctor a clear description of the symptoms you have experienced. Although there is no cure for IBS, there are things that can help and manage the symptoms. Hypnotherapy, relaxation training, a controlled diet, medication, and cognitive behavioural therapy have all been found to ease the symptoms of IBS. The NICE guidelines. One IBS treatment recognised by the National Institute of Health and Care Excellence, NICE, is hypnotherapy. NICE recommended that people living with IBS who do not respond to pharmacological treatments after 12 months should consider a referral for psychological intervention such as cognitive behavioural therapy and/or hypnotherapy. And I'll leave a link to the NICE guidelines in the description box so you can check that out for yourself. So what about hypnotherapy and IBS? Hypnotherapy for IBS can help you to learn relaxation techniques as well as learning new ways to manage stress. This is because the state of our mind has an impact on our physical well-being. Therefore, the tension, stress and anxiety often caused by IBS may undermine the immune system and further affect health. By learning how to relax and manage stressful feelings, which can then become a useful life tool, hypnosis can help to promote positive thinking and develop coping strategies. It can also help you recognise the problem and access your unconscious, subconscious mind. There have been a number of clinical studies which have found hypnotherapy for IBS to be an effective treatment, and this includes a recent study published in The Lancet, which I will also include a link for in the description box. So while each hypnotherapist will differ in their approach, typically IBS treatment through hypnotherapy includes recognising and learning to cope with any worries or fears that are contributing to your IBS, increasing your confidence and well-being. Learning self-hypnosis techniques so that you can continue the sessions at home and throughout the rest of your life. Setting goals, so you may be encouraged to visualise the future and how you would feel without IBS. And these may be long-term goals, or they could be a number of things that you want to achieve over a period of time. Visualisations and suggestions, with the aim of decreasing the sensitivity of the gut and increasing your confidence in your body's abilities. Some people have seen results after just 1 or 2 sessions of hypnotherapy for IBS, but every person is different and your progress will depend on you and the plan that you have devised with your hypnotherapist, plus other factors that are affecting your life. So what is gut-directed hypnotherapy? Gut-directed hypnotherapy can help to address the miscommunication between the brain and the gut, whereas most traditional forms of IBS therapies focus more on treating the symptoms and promoting relaxation. Gut-directed hypnosis focuses much more on the mind. So what can hypnotherapy do to correct those messages that are happening in your mind? Gut-directed hypnotherapy changes the function of the gut, and it works by changing the communication between gut and brain, reducing the hypersensitivity of the nerve cells and releasing the IBS. Hypnotherapy also teaches the mind to control the gut, not the other way around. Stress and anxiety make the IBS symptoms worse, and hypnotherapy helps by activating the parasympathetic nervous system. So it basically stimulates the body's rest and digest phase while the sympathetic system gets you in fight or flight mode. So the parasympathetic system is a set of long nerve fibers going from your brain to various organs, and they connect them to particular neurons so that they can help send those signals from organs to brain. Hypnosis helps to activate this system. It can also help to change the subconscious responses to situations such as fear of needing the toilet when away from home or fear of eating certain foods. In gut-directed hypnotherapy, the suggestions are focused on creating physical changes. They also focus on improving your emotional well-being. Since the subconscious works with images, metaphor is a powerful way to communicate with the subconscious mind. And that is often why hypnotherapists use lots of visualizations in their sessions. So, for example, you might imagine drinking a soothing, healing liquid that coats your entire digestive system and soothes discomfort. Your subconscious then uses these images to create physical changes so that you experience relief. This form of treatment guides you into a focused state of awareness and uses suggestions and imagery to calm the digestive tract and prevent unnecessary focus on the discomfort in the body. This approach is thought to be most effective when used in conjunction with other medical treatments and other ongoing self-care practices. So how can I help you with IBS? So through the sessions, we will work on different factors. Initially, I will show you how to stimulate your parasympathetic nervous system and put the body into a state of rest and digest, relaxing your body, releasing tension and soothing the nervous system. Secondly, we will work in the mind to learn how to manage stress, relieve anxiety, and create a balance in the body. Thirdly, we use the use of gut-directed hypnotherapy, where you will help to learn how to engage your subconscious mind to control your gut function, reduce sensitivity, and correct the communication and neural pathways in the gut-brain axes to relieve pain, bloating, constipation, diarrhea, and urgency. This will result in you being calm, in control, and confident. So I hope you've enjoyed this video about irritable bowel syndrome. And if you're interested in learning more about this topic or you want to talk to a professional about it, please feel free to contact me. I'll leave the link in the description box and I look forward to hearing from you and I'm happy to help in any way that I can. Thank you for watching this video. I always enjoy sharing my knowledge and expertise with you and take care and we'll speak soon. Thank you. Bye.